Well, I'm Dr. Jon Caulfield. I practice in Littleton, Colorado. I work with Vivos Therapeutics. When we're treating airway and sleep with patients, a lot of times, people are like, well, what do you look for? And many times we do our hygiene exam, we come in and there's wear. There's occlusal wear, incisal wear, there's cervical fractions. We see recession around people's teeth. And so what I've started to realize and what we're learning is that all of these are due to airway issues. Scalloped tongue. There's all these signs and symptoms that are on every patient we see every day in our practice if we just start to look a little differently and ask some different questions. And so what I've found now is by looking for these hallmark signs of airway protection, because they're clenching, they're grinding, they're trying to keep their tongue from falling back into the airway all night long. These are the kind of things that I look at and I see over and over and over again. And we used to think, well, how do I fix that? But we never asked why. Why do we need to fix that? And this is where airway and sleep are really kind of making their biggest impact in dentistry. And that's where sleep dentistry is really got a great foothold in our profession. And I think we need to take it to another point. So what I would recommend is when you're doing your hygiene exams, instead of just looking for the gums and the teeth, let's start looking for these signs of incisal or occlusal wear. Look for the scalloping of the tongue. Look for the linea alba, the bite cheek marks. But starting to look at patients in a little bit more of a whole, comprehensive way, where we're seeing all these subtle signs and symptoms that tell us of a big underlying problem. And that's my expert tip.